Hi, this is Nathan Baer, and Shaun and I put together a quick presentation on the role of pharmacists in association with the Patient Protection Affordable Care Act, also known as PPACA or Obamacare. And here's a quick overview of the presentation. First, we'll start with some background information, and then we'll dive into how the Affordable Care Act affects pharmacists, and we'll discuss why the Affordable Care Act is pertinent to pharmacists, how it affects the role of the pharmacist, and then we'll look at a quick study regarding the pharmacist's motivations and perspectives on the Affordable Care Act, and then we'll end with a short conclusion. So to start everything out, here's a simple true or false question. Currently, pharmacists are recognized as healthcare providers under federal law. And if you answered false, you would be correct, because currently under federal law, pharmacists are not recognized as providers. For a long time, pharmacists have been advocating for an increased role in the healthcare field as providers, and currently pharmacies are not recognized under federal law, but on March 11, 2014, the bill H.R. 4190 was introduced to the House of Representatives, and if passed, the bill will recognize pharmacists as healthcare providers, and pharmacist services will be covered under Medical Part B. And the Patient Protection and Affordable Care Act, signed by President Obama on March 23, 2010, has helped pave the way and had an impact on the pharmacist's role within the healthcare system, mainly because there's many provisions which impact the pharmacist, and the Affordable Care Act recognizes the pharmacist as a healthcare provider. And the pharmacist is in fact directly recognized as a healthcare provider under the Affordable Care Act. It is stated within the PPACA that the term healthcare workforce includes all healthcare providers with direct patient care and support responsibilities, such as pharmacists. And following that definition of the healthcare workforce, the Affordable Care Act describes the term health professionals to include pharmacists as well. And then the Affordable Care Act also describes that pharmacists are an eligible entity that may conduct and participate in interdisciplinary training and may be able to use the funds granted for that activity. And this is of great importance to pharmacists, that the Affordable Care Act does not only recognize them as healthcare providers under federal law, both as a part of a healthcare team and in their own right, but also goes on to specifically describe some of the services pharmacists may offer as healthcare providers, such as medication therapy management services and those under the prescription drug program. The American Pharmacists Association describes how many provisions of the Affordable Care Act will directly or indirectly impact the pharmacy profession, and below is a list of the issues discussed. And as you can see, it's not an extensive list, but it is some of the more important things where the profession of pharmacy is directly impacted. With the Affordable Care Act being very relevant to pharmacists, and the fact that pharmacists aren't recognized as healthcare providers under the Affordable Care Act, it's important to determine the pharmacist's perspectives on the act. So in 2013, a cross-sectional design study was done to try and gain pharmacists' perspectives. And what they found was that a majority of the pharmacists surveyed agreed that the healthcare system as it stands today is in need of reform. And a majority of the pharmacists agreed that understanding the health system policy and being part of the reform is a responsibility of a pharmacist. It was interesting to see that many did not understand all of the major provisions under the Affordable Care Act, and the fact that many were in favor of repealing the act. But this is not a great surprise, considering that the Affordable Care Act was essentially created and put into law under Democratic Party lines, and the majority surveyed were conservative. And so to conclude this presentation, the Affordable Care Act has increased potential for opportunities for pharmacists to act as healthcare providers, and there are many provisions that directly or indirectly impact the role of the pharmacist. And it would be appropriate to assume that the best course of action at this point is for pharmacists to become informed regarding how the Affordable Care Act is affecting or may affect them, and to make sure that the healthcare professionals that they work with are well informed, so that the specialty knowledge and skills that pharmacists have to offer can be used to the benefit of both healthcare providers and patients through the Affordable Care Act. Thank you.